Hello friends, I am Dr. Salam, maxillofacial and microvascular surgeon. Today in this lecture we will discuss about oral leukoplakia. Leukoplakia means white lesion. Any white lesion within the oral cavity that cannot be considered as any other definable lesion can be considered as oral leukoplakia. If you look at the epidemiology, the global prevalence is only 2.6%, whereas if you look at India or the South Asian countries, the prevalence is much more higher. It is more than 6%. Male are more common than female, and onset it is most commonly seen after 30 years of age. For a non-smoker, the most common site is the borders of the tongue because of the chronic irritation from the sharp tooth or sharp denture. And the lesion which is present on the floor of the mouth or the lateral border of the tongue are most prevalent for transforming into malignant lesion. The etiology or the causes of the oral leukoplakia is because of the chronic irritation. The chronic irritation could be because of tobacco consumption or alcohol consumption. It could be because of fungal infections such as Candida albicans, because of viral infection such as human papillomavirus, or it could be because of nutritional deficiency, or sometimes it is on a rare occasion it could be a genetic causes. Basically, there are two types of leukoplakia. One is homogeneous, another is non-homogeneous. Homogeneous, we have only the white lesion, no other lesions. In non-homogeneous, apart from the white lesion, there could be some red lesions also. Basically, there are two types of leukoplakia. One is homogeneous, another is non-homogeneous. Homogeneous, we have only the white lesion, no other lesions. In non-homogeneous, apart from the white lesion, there could be some red lesions also. Homogeneous leukoplakia is complete white lesions. Some areas it could be appears as a crack line appearance. Now this lesion, in some areas it could be thin white lesion, or some areas it could be thick white lesions. The thick white lesion is because of the more hyperkeratinization. Homogeneous leukoplakia is complete white lesions. Some areas it could be appears as a crack line appearance. Now this lesion, in some areas it could be thin white lesion, or some areas it could be thick white lesions. The thick white lesion is because of the more hyperkeratinization. Non-homogeneous leukoplakia, again it can be divided into speckled leukoplakia, nodular leukoplakia, verrucous leukoplakia, or a proliferative verrucous leukoplakia. Speckled leukoplakia, it is a mixed lesion. Predominantly it is a white lesion, but some areas it could be appears as a red lesion. This is also known as the leukoerythroplakia. In nodular leukoplakia, there are small polypoid outgrowth or nodular-like appearance of white lesion, and in between this white lesion there could be some red lesions also. In verrucous leukoplakia, it appears as a wrinkle or corrugated surface appearance, or sometimes it appears as a brush-like or cauliflower-like appearance. This is known as the verrucous leukoplakia. Now next is the histology. If you do a biopsy, mostly you will see either it is a hyperkeratosis or there is a dysplasia. The dysplasia could be mild, moderate or severe, or it could be carcinoma in situ. In London 2010, there is a binary classification. One is low risk, that is mild and moderate dysplasia, and high risk, that is severe dysplasia or the carcinoma in situ. So there are only two classifications, low risk and the high risk. In low risk category, we feel mild dysplasia and moderate dysplasia, and in high risk category, we have the severe dysplasia or the carcinoma in situ. Some of the leukoplakia can transform into malignant lesion. The lesion which is mostly seen in the borders of the tongue or the floor of the mouth, prone for transforming into malignant lesion, lesion which size is more than 2 centimeter, or the lesion which is seen in a non-smoker female are more likely to develop malignant lesion, or the lesion which is mixed lesion or non-homogeneous red and white lesions. So these are the lesions that can transform into a malignant lesion. The treatment of leukoplakia are, first thing is the lifestyle modifications, that we have to stop all kinds of habit. It could be smoking, tobacco consumption, alcohol consumption, maintain a good oral hygiene, and maintain a healthy lifestyle. Apart from lifestyle modifications, we have two kinds of treatment. One is non-surgical, another is surgical. In non-surgical treatment, the treatment of choice is giving carotenoids, vitamins, mainly the vitamin A, E and C, and anti-neoplastic drugs. And also there are phototherapy. So these are the non-surgical treatment. Beta carotene is mainly found in dark green leafy vegetables, yellow or orange vegetables or fruits. Examples such as spinach, carrots, papaya, sweet potato, mango, bell pepper, oranges, etc. Now these food products, it contains very large amount of beta carotene. Our daily recommended doses of beta carotene is 6 to 15 milligram. Now how does this beta carotene acts? It diminishes the effect of free radicals and thereby reducing the chances of leukoplakia. Lycopene is a fat-soluble red pigment mainly found in the fruits and vegetables such as tomato, pink guava, watermelon, papaya, red bell pepper, mango, cabbages, etc. Our daily recommended dose of lycopene is only 8 milligram. It acts by diminishing the effect of free radicals and also interferes with the growth factor receptor signaling. So this is about beta carotene and the lycopene. Next is the vitamin A. Vitamin A is important for maintaining the integrity of the epithelial tissue surface. Vitamin is mainly found in the fruits, vegetables, dairy products, meat, fish, eggs, fortified foods, etc. So our daily recommended dose of vitamin A is only 1000 micrograms per day. Vitamin E is a group of 8 fat-soluble compounds, that is 4 tocopherol and 4 crocotrienol. It acts as antioxidants, it maintains the cell membrane integrity, and it improves the neurological functions. The recommended daily allowance is only 15 milligram per day. It's mainly found in the nuts and seeds such as almonds, peanuts, hazelnuts, sunflower seeds, plant-based oil. It found in fruits such as avocado, mango, kiwi fruits, blackberries. It's also found in vegetables such as beet greens, red bell peppers, spinach, etc. Vitamin C is mainly found in all kinds of citrus fruits such as limes, oranges, lemons, tomatoes. It's also found in red and green bell peppers, kiwi fruit, strawberries, green leafy vegetables such as broccoli, etc. The daily recommended doses is 100 to 120 milligram per day. Another treatment of choice is the anti-neoplastic drugs such as bleomycin. Though it is very rarely it is used, it can be given injection or by giving topical applications. Other drug of choice is the polyphenol or is the chemopreventive agents such as curcumin. It has antimicrobial, antiviral, antifungal, antioxidant and chemosensitizing properties, known to suppress the tumor initiation, promotion and the metastasis. Another non-surgical treatment option is the photodynamic therapy. However, since I have never used it or seen it applied, I don't have a clear idea or understanding its effectiveness. Surgical treatment is an option for small lesion and is the preferred approach for the lesion that are likely to develop or become malignant lesion.